In America, a society that applauds youth, beauty, and productivity, we tend to distance ourselves from death. Perhaps the only universally shared human experience, it is also the most denied. When the reality of death bursts into our lives, as it inevitably will, most of us are initially unprepared to cope with it. Few are experienced at even discussing the subject of death and dying. For those committed to caring for patients and their families, however, understanding the nature and complexity of grief and bereavement is essential to providing the best overall care. Sudden, unexpected health crises are inevitably traumatic. Many people refer to them as bad dreams, reflecting the surreal, unbelievable feelings that accompany such events.
So sorry this happened, Laura.
I don't understand. I don't understand. I feel fine.
I'm glad of that. Your youth and your otherwise good health are going to serve you well.
Couldn't you have made a mistake, Doctor? Cancer doesn't even run in our family.
It couldn't be so many places so fast.
According to noted expert Elizabeth Kubler-Ross, a terminally ill person will most likely progress through several transitional levels of grief, including shock, denial, anxiety, guilt, anger, bargaining, depression, and acceptance. Many contemporary experts, however, believe there is no set order to these feelings.
Whenever there's a stage theory, it connotes that there's some predictable sequencing. And so what happened, like with the Kubler-Ross theory, was that people thought, okay, I should be angry. Or what happened, I didn't go through the bargaining phase, there must be something wrong with me. And in fact, sometimes counselors, those people that were trying to support them, felt that they were derelict by not going through the phases. When we know people all on the same morning can be depressed, angry, bargain, and accept.
While individual cases will vary, experts refer to some basic losses that most patients will grieve throughout the progression of their illness.
Go to sleep fine, but then about 12 or 1, I'm awake.
What do you think about, Mary?
Every week I just seem to be getting worse.
Many of these losses are interconnected. For instance, the loss of mobility and the loss of autonomy.
Is there something I could take to make me sleep?
Well, Mary, you have several options. I know of a good medication that won't make you feel drugged in the morning, but kind of sounds to me like the anxiety you're feeling is also a problem.
Especially when I'm alone at night. I just get so worried about my breathing, or my lack of breathing.
Grieving the loss of your physical self, the way you used to be, is often one of the first and most intense losses patients experience.
A terminal illness, I think, has to rank right up there at the top with a situation that takes away your control. There is so little you can do.
There's a certain vulnerability that arises for the person, and that is suddenly a person who may have been very in control of their life and perhaps in control of others is suddenly at the mercy of a person caring for them. Perhaps they need someone to bring them food, someone to bring them medication, someone to help them go to the bathroom, someone to help them get dressed on a daily basis.
These are huge losses for people, and to have some depression in response to those situational losses is pretty normal and appropriate.
Helping patients achieve their maximum level of independence is essential for these reasons. Besides the loss of control, terminally ill patients face other deprivations, including the loss of community interaction, material possessions, the ability to complete plans and goals, and perhaps the most devastating, the loss of people and relationships.